So let's give you 7 ways to quit vaping. This is not an actual vape. First things first, setting a quit date. Usually when you start to think about quitting, you should be setting a quit date 2 to 4 weeks out. Research shows this is one of the most effective strategies. And when that date comes around, it makes sense to hit that smoke cessation abruptly. You may want to also decrease leading up to it, but the research kind of shows both ways work. A lot of people need to address the barriers to quitting. The number one biggest thing, people are worried about the nicotine withdrawal. And here to tell you that usually it lasts about 3 days. It takes 72 hours for all the nicotine to get out of your system. And then over the next 2 to 4 weeks, you usually will get ups and downs. Usually there's a lot of triggers that were incorporated into your life, so you need to try to avoid those things. If you have friends that smoke vapes all day long, you should probably avoid them for a little bit. If you're vaping when you drink, you should probably hold off on drinking. All these things are very important. Number 3, we talked about the withdrawal and stuff. Let's talk about medications. This is going on to 4. Chantix is the most effective medication. It blocks some weird nicotinic receptors. It's like the alpha-4, beta-2, and truth be told, I'm sure they don't actually know exactly how it works. It works really well. A lot of people quit pretty quick on it. What it does is kind of cuts down on the reward that you get from smoking and makes it less desirable because you're just getting the taste. A lot of people do really well with it. Some people have weird dreams. Some people like the dreams, some people don't. I think it's the brain getting more oxygen at night, so anyone that's going to quit smoking or tobacco products is going to get more dreams at night. So there's a few strategies you can do to prevent these things from happening. The next thing is nicotine replacement. If people are having a really hard time, you usually want to consider some nicotine products to prevent and slowly wean these back. The research shows that if you use a combination of a long-acting and a short-acting, and you can even combine this with Chantix, for example, use like a patch, and then when you have cravings, use gum or something else. That usually works the best, and a lot of people have great results with this. If Chantix isn't your cup of tea, there's a few other ones. The next one I usually find results with is Wellbutrin. It helps people have a lot of anxiety and a depressed mood. We find that people usually after a week or 2, their body starts making their own neurotransmitters, and they usually feel like a low-level joy kind of going on. Next thing, number 7, is counseling. People always think counseling is just for anxiety, depression, but it's worth talking it over with a counselor. They deal with addiction issues all the time, and they can kind of figure out exactly what's going on and help you strategize. So hopefully those things give you some hope. Know that you can do it. This wasn't going to be a smoke cessation video, but I see everyone vaping these days, so I figured we'd tailor it to that. We've gotten a decent amount of people off that wanted to quit. They don't really know the long-term results of these things because they're new, and I'm guessing they're probably not that good. Dr. Jon Swetech over at Swetech Medical Center, like our Facebook page or check out our website. We'd be happy to be your primary care. Thank you. Have a good one.